Hey, it's Dr. Terry Presley here again, and let's talk more about your rehab and recovery after total hip arthroplasty. Now, for total hip arthroplasty, you need to know if you're going to have any restrictions after the surgery, because there's multiple different approaches for total hip arthroplasty. There's the anterior approach, the lateral approach, and the posterior approach, which is from the back. Now, I've got a previous video on these if you want to learn more about the actual approaches, but as far as restrictions, I do surgery through the direct anterior approach, which means I don't cut any muscles. You don't have any restrictions after the surgery, and patients have been shown to have a faster recovery after that. Now, if you have a lateral approach or a posterior approach, you need to talk to your surgeon if you're going to have any restrictions, because sometimes those have restrictions where you can't bend past 90 degrees, you can't internally rotate your leg, and you can't cross your legs. So you want to know if you're going to have any restrictions, because that might affect your outcome. So ask your surgeon which approach he uses and if you're going to have any restrictions, so you can prepare for that post-operatively. Because especially for posterior approach, if you can't flex past 90, you got to think about getting a raised toilet seat. So these are just things to think about. Now talk to your surgeon, and until then, we'll talk later.